When many of us dream of the day we retire, we often think of extended vacations and enjoying the fruits of our lifelong labor. But do you also dream of doctor's visits, prescription costs, major illnesses? I'm guessing the answer is no, which is why Cory Sickles of Safe Harbor Retirement Group makes healthcare planning a top priority. Thanks for joining us again, Cory.
Thanks to be here.
So these numbers are sobering. Fidelity Benefits estimates the average cost of healthcare $285,000 for a couple over 65. And nearly half of that is just co-payments, deductibles, hospital visits. I mean, it's unreal. But knowing that, what can we do to ease that burden?
Well, you know, there's a lot of things that you can do, and I'll talk about that. But I don't think, first of all, I don't think a lot of people will just plan for this. I mean, those are big numbers. But, you know, one of the first things that you can do is a health savings account. You know, in a lot of cases, your employer might offer one. And if they do, I definitely would say put money into that. If they don't, then you can also maybe even look into one outside of your employer. But here's the nice thing about a health savings plan. It actually can reduce your taxes, so it's pre-tax, but then it grows tax-free. And when you take it out, when you retire, then you can use it for your medical expenses at that point in time.
That seems like a great idea, but we all know there are expected medical costs and unexpected medical costs. So how can we plan for that in the future?
Well, the easiest part is really to work with a financial planner or, you know, an advisor like myself, because we can help you plan for that. So many people that come in and sit down with me, the one thing that I would probably say is that I really don't see sometimes a plan for healthcare costs. You know, they have their plan in order to get to their budget, but really what you need to do is be able to have a savings or a nest egg or you know, an emergency fund. Now that's really kind of some of the things we're talking about in order to pay for some of these unexpected costs in retirement.
And long-term care falls into that category.
Long-term care definitely falls into that category. And there's I think a lot of people think of, do I really need long-term care or not? And one of the best really products out there today is using life insurance. A lot of people will say, well, I don't need life insurance. But the way life insurance products work today is you can take that death benefit amount and be able to use that for long-term care costs. And then if you don't use it for whatever reason, something unexpectedly happens, then you have a death benefit that does go to your beneficiaries as well.
When it comes to figuring out the best age to claim Social Security benefits, everyone is different. What do you take into consideration when figuring out what age is best for your clients, Cory?
Well, everyone's situation is different. That's the first thing I would definitely say. But we have a Social Security maximization report that we can run, you know, for you to be able to see when is the best time for you, or if you're married, for you and your spouse to be able to trigger your Social Security benefits. You know, every year you delay, you're going to make a little bit more money. We know healthcare costs are going to keep going up, and one of the things you're going to want to be able to make sure that you have is more income. And you know, about 40% of most people's income in retirement is Social Security, so you want to make sure you're triggering it at the right time.
Now, we've had a lot of discussions about Medicare in the recent weeks with enrollment going on, and we know Medicare does not cover that long-term care we were talking about. What would you suggest?
Well, again, everyone's situation is different, but I think one of the things we definitely can look at is to be able to put a long-term care policy in place. And again, you know, I mentioned life insurance, you know, a while back, or you know, just a few seconds ago. But the way life insurance works today is you can pay a monthly premium. It's going to give you a death benefit. And in some cases, say you have money sitting in a bank account, you can actually just put down a lump sum into it. And there's products out there that if you ever need the money back, you can actually pull the money back as well. So there's a lot of different solutions. Everyone's a little bit unique. So the best thing to do is really come in and sit down and see which is right for you.
And at Safe Harbor, you also offer assistance to people who are considering their Medicare Advantage options. What are the biggest concerns you're hearing from your clients right now?
Well, I think the biggest concerns when we start talking about healthcare, I mean, it's healthcare cost. Mm-hmm. And one of the things we're able to do is we can actually sit down with you, look at your plan, what kind of Medicare Advantage plan you're on today, and be able to recommend, you know, something. There might be something out there that's actually cheaper. You actually will be able to get more benefits. And at the end of the day, you're in a better situation. It's something that you really should look at every year, because plans do change. And it's something that everyone really should be doing.
and they can schedule a complimentary meeting with you. What will that entail then?
So it's pretty simple. We can actually email you a form before you even come in. Give us your prescriptions, all your doctors, and we can even tell you over the phone whether it even makes sense to come into the office. We'll be able to tell you whether or not we can actually help you from, just from that form.
You can really help sort it all out because it can be overwhelming.
Yes, it can be
when you're
overwhelming.
planning for your future. SafeHarborOH.com.
Yep.
Call Cory and his team. They can help you out. Thank you so much,
Thank you.
Cory.